Welcome to today's video. Today our topic is childhood disorders. What are the disorders that are very common in children? How do we identify them? And what may be their possible treatments? So if you're interested, keep on watching. There is a great diversity of childhood disorder forms and causes. Some of these disorders are primarily due to disorders of physiological causes. On the other hand, there may be some disorders which are more behavioral in nature. Some disorders are caused by neurochemical problems or structural abnormalities of the brain. They can be innate, that is appearing, or shortly after birth they can come up, or they may result from physical stress such as illness, injury, emotional stress, trauma, anything like that, or even a sense of loss or problems in family. Now, behavioral problems on the other hand are outward signs of difficulty displayed at home, at school, among friends, in family, or otherwise outside the child's environment in a child who was otherwise physically healthy. Like brain-based problems, behavioral problems may also result from physical or emotional stress. It must be noted that the division between brain-based and behavioral disorders is somewhat arbitrary in many cases. Brain-based disorders such as ADHD clearly impact a child's behavior in school and at home, and vice versa. Many other disorders that were previously thought to be primarily behavioral in nature have turned out to have biological component to them as well. This is very interesting to note actually. Some of the childhood disorders can be cured or otherwise resolved, or they can be dealt with, while others they can end up becoming chronic or long-term problems. The disorders we discuss also vary in terms of prevalence and severity. Prevalence refers to the ratio or the percentage of how often a disease or disorder occurs within a group of people in a population at a given time, and these are always based on research. Now, recently the American Psychological Association has noted an increase in the prevalence of childhood mental illnesses as a whole. Now, there are estimates that indicate the current prevalence suggests that between 17.6% and 22% of children have symptoms of one or more childhood disorders, and that 15% of American children suffer from mental illness that is severe enough to cause some level of functional impairment. Now, despite how common they may be, childhood disorders are not part of normal developmental processes. These problems are manifested during childhood, and children are expected to go through them. This is not normal. The diagnostic criteria for childhood I don't know what happened to my voice. The childhood mental disorders requires that children's behavior or the developmental deviations from normal age appropriate behavior or development. So understanding normal child development is very important to identify what is the difference between the normal and that is deviant from normal. For this reason, I would request to read several books that are available that are concerned with the problem of children and childhood disorders. And also it is important to know the normal developmental milestones at different ages. It puts us in a better position to know what are the normal milestones and what a disorder or problematic behavior can be. Now we will be discussing common childhood mental illnesses and developmental disorders. These include depression, it is very common in children, bipolar disorders, anxiety disorders, this is also very common, autism and similar pervasive developmental disorders. Attention deficit hyperactivity disorder is also a very common problem in children, learning disabilities, adjustment issues, adjustment disorders, oppositional defiant disorders and conduct disorders. So these are very common disorders that are found, but it is very important to learn them, to know them for identification purposes. And these disorders are not strictly childhood disorders, but instead affect both children and adults. Now, since we have already discussed these disorders in detail, and I would also suggest to go through other videos as well, and the following videos that will be coming up, which I'll be focusing on several other specific childhood problems. We'll just go through the common ones for now, just as an introduction. Now, childhood mental and developmental disorders encompasses neurodevelopmental and emotional and behavioral disorders that have broad and serious adverse impacts on psychological and social well-being of the child. Children with these disorders require significant additional support and attention from families, educational systems, and significant caregivers. Now, these disorders are frequently, they persist into adulthood as well. Now, research has found out the more before the beginning of the childhood, we find them, we diagnose them, and we go for treatment, it is better treated and problems are avoided. Now, these children are more likely to experience a compromised developmental trajectory. Now, with increased need for medical and disability services, as well as increased risks of contact with law enforcement agencies, it is important to identify them, and all these groups of people from these professions should work together, allied, so that they can give a better service to these children. Now, children's symptoms vary depending on the type of the mental illness that the child is having, but there are some general symptoms as well. Now, for example, there may be changes in the school for performance, such as poor grades despite the child is giving good efforts. There may be abuse of drugs, taking alcohol, taking substances, or maybe interacting with people from different groups, and that is not healthy for the child. Inability to cope with daily problems and activities in general. There can be changes in sleeping or eating habits. Now, at the same time, there may be excessive complaints of physical ailments like headache, stomach ache, some even complain of eye problems as well. And all these things must be seen carefully. Defying authority, skipping school, stealing, or damaging property. These are very significant important factors. Now, intense fear related to body image, getting weight, and getting bullied by other people, and long-lasting negative moods, often accompanied by a poor appetite and, of course, thoughts of hopelessness, helplessness, even death. There may be frequent outbursts of anger. There may be loss of interest in friends, in activities that they previously used to enjoy. Now, significant increase in time spent alone can also be an important marker. Now, excessive worrying or anxiety, that is also a trait, or even hyperactivity. This should be also noted. Now, persistent nightmares or night terrors are often very common in children who are going through problems. Persistent disobedience or aggressive behavior, it may be very common as well. Frequent temper tantrums, hearing voices, seeing things that are not there, hallucinations. But before making any diagnosis, you should always consult a professional. Childhood disorders. Now we are going to talk about the specific disorders that are common. One of the common disorders is of course anxiety disorders. Anxiety disorders are characterized by excessive or inappropriate fear with associated behavioral disturbances that impair the functioning of the child, according to American Psychological Association. Children with anxiety disorders have clinical symptoms such as excessive anxiety. Now, severe physiological anxiety symptoms like blurred vision, headache, palpitation, breathing issues, etc. There may be behavioral disturbances such as avoidance of feared objects, associative distress, or impairment. These are all common. And another common is fear of exams or schools or any kind of fear related to study. This is also very important. Another is separation anxiety disorder. Then we have panic disorder, generalized anxiety disorders. These are also found to be very common in children along with obsessive compulsive disorders. Next, we have phobia as well as selective mutism, rare but is there in children. After that, we have pervasive developmental disorders that are prominent in children, and let's see what are those. First is attention deficit hyperactivity disorder or ADHD. Now, ADHD is a neurodevelopmental disorder that is characterized by inattention and disorganization. With or without hyperactivity, impulsivity, that is causing impairment to the functioning of the child, according to APA. Now, ADHD persists into adulthood in approximately 20% of the individuals, it has been said. Also, I have mentioned the research. You can go through in the description and check them out yourself. Then comes autism. Autism is a neurodevelopmental disorder that is characterized by severe impairment in reciprocal social interactions. These children have difficulty in social interaction and communication skills, as well as there are presence of restricted and stereotypical behaviors. That is also very common. Now, then there is rest disorders, Asperger's disorders, intellectual disability or mental retardation. Now, intellectual disability is a generalized disorder that is characterized by significantly impaired cognitive functioning and deficits in two or more adaptive behaviors. And it is always diagnosed before the age of 18 in the developmental years. It is prominent. Then we have disruptive behavior disorders. One being conduct disorder. Conduct disorder is diagnosed in children under the age of 18 years and is characterized by a pattern of antisocial behaviors that violate the basic rights of others or major age appropriate social norms. Then there comes oppositional defiant disorder. Expressive language disorder, that is another that is found in children, and it is often very common. Our next subcategory is elimination disorders, learning and communication disorders. Under that, we have stuttering, language-based learning disabilities, selective mutism, and definitely and not least, reading disorders and or dyslexia. Then written expression disorders, mathematics disorders. After that, we have the heading or the broad umbrella terms or affective mood disorders. Under those, these are specifically depression, bipolar, then there is schizophrenia. Under schizophrenia, paranoid and disorganized are more common in children, but there may be others as well. Catatonic is also very common. Then there is tic disorders, again very common in children and found in early childhood. Tourette syndrome, obsessive compulsive disorders, transient tic disorder. This is again another thing that is very common in children, and stereotypic movement disorders. Now all these disorders, some are very prominent in childhood years, and they are specifically, we do a diagnosis in children because in the growing years we find them in the behavioral pattern and that seek for therapeutic intervention, but not necessarily that it is restricted to the children. For example, bipolar disorders, mood disorders, depression, OCD, all these things are of course common in adults and can be diagnosed in adult years as well. And the person can have depression in adult years who never had that in children, obviously. But there are some disorders which are very common and diagnosed during childhood years, like intellectual disability, autism, rest disorders, then there may be ADHD. So these are the common disorders that are obviously diagnosed during the childhood years. And after discussing this, it is very important what are the treatments. Now treatments, there are two varied type of treatments. There is obviously psychological management and assessment of the problems and behavioral modifications, as well as other psychological therapies that are available, along with psychotropic medications. Pharmacotherapy is always there. Some disorders, it is better to go for both. Some is more psychological oriented, but more often than not, it has been found out that medication along with psychotherapy gives the best result. At the end, I would really like to say this, that this video is for educational purposes. Going through just the symptoms If you find that, if any parent is watching, if you find your child is having this kind of problems, I'd suggest that you please go through the other videos of the list which has a detailed description, but those are not for diagnosis. If you think that your child is having these problems or somehow the symptoms are matching with your child, definitely seek a professional help. Go to a professional who knows this and who knows how to diagnose. This is not just your journey. Seek help, and there is help, of course. To know more, you can always share your information, and if you have any queries, comment over there. And don't forget to subscribe, because I'll be coming up with lots and lots of psychological videos, topics on self-improvement, dealing with exam anxiety, dealing with life, on spirituality and childhood problems. So many things are there to cover, and if you're interested to know more, please subscribe, don't forget, and I'll see you next time.